Hello, my name is Johanna and I'm a third-year pharmacy student at UW-Madison. I'm talking to you today with the organization GenRx, where we try to raise awareness about prescription misuse and abuse and talk about ways to prevent this problem. We wish we were talking to you guys in person, but given the circumstances, we will be virtually talking about the what, the who, the why, and what you can do regarding prescription drug misuse and abuse. First, we'll start with what. What is abuse, what medications are abused, and what is the opioid epidemic? So what comes to mind when you guys think of prescription drug abuse versus prescription drug misuse? Just take a few moments to think in your head what the difference between these two terms might be. Prescription drug misuse and abuse can be described as taking a drug that's not yours, taking more of a drug than you're supposed to, or taking a drug for a reason other than you're supposed to, even if it is your own prescription. When taken as written, prescription medications can benefit a lot of people. What we're talking about is when you are misusing your own medication or abusing someone else's. So what are some commonly abused medications or medication classes that you guys can think of? Again, just take a few moments in your head to think of what some of these might be. One medication class you may have heard of are called opioids. These are medications that are used to treat pain. Some examples of them are oxycodone, morphine, and hydrocodone. Another class of medications that can be abused are called stimulants. Some examples of these are Ritalin and Adderall. These medications can be used to help treat ADHD and also are used for some sleep disorders like narcolepsy. Another category are called sedatives. Examples of these ones include Valium and Ambien. These medications can be used to help treat anxiety and can also be used to treat some sleep disorders. And the last category we have on here is called dextromethorphan. This is actually an ingredient found in over-the-counter and prescription drugs, oftentimes in cough medicine, and when consumed in large amounts can also be very harmful. Next, we're going to talk a little bit about the opioid epidemic. This is a term that describes the increase in opioid use and abuse in America. The opioid epidemic can be described in three waves. The rise in opioid overdose deaths first began in the 1990s, and it involved prescription opioids like morphine and oxycodone. The second wave began in 2010 with increases in overdose deaths involving the illicit drug heroin. And most recently, in 2013, we saw a third wave that included increases in overdose deaths involving synthetic opioids like illicitly manufactured fentanyl. From 1999 to 2018, more than 450,000 people have died from an opioid overdose. 2 out of 3 overdose deaths in 2018 involved an opioid. It's estimated that about 128 people die every day from an opioid overdose. This includes prescription and illicit opioids. Illicit meaning illegal. This is a figure that illustrates the overdose death rates involving opioids in the U.S. from 1999 to 2018. I want to draw your attention to this darker colored line that shows how we've recently seen a spike in synthetic opioids contributing to overdose deaths. And on a positive note, the green line shows us that we're actually finally seeing a decrease in overall overdose death rates involving opioids. That being said, opioid overdose deaths were still 6 times higher in 2018 than in 1999. Now we're going to move on to the WHO. Who abuses prescription drugs? About how many Americans aged 12 and up abused a prescription medication in 1 year in 2017? What do you guys think? The correct answer is C, 18 million. As far as demographics go, prescription drug misuse falls into every age range among both men and women and across all socioeconomic lines. Misuse of prescription drugs is highest among young adults ages 18 to 25, with almost 15% reporting non-medical use in the past year. And it's not just young people. 1 in 4 adults over the age of 50 abuse a psychoactive medication. Psychoactive means a drug that affects the brain. Prescription drug abuse affects every state in the U.S., from small towns to big cities. The main take-home of this slide is that it doesn't really matter who you are, or where you're from, or where you live. This really is a problem that is affecting everyone in the U.S. Here are just a couple more statistics. Nearly 1 in 5 high school students report abusing medications that were not prescribed to them. 1 in 3 teens report knowing someone who abused prescription medications, and every day, 2,500 youth students between the ages of 12 and 17 abuse a prescription pain reliever for the first time. Now, these numbers might seem pretty high to you, and they are, but we want to remind you guys that even though 1 in 5 high school students report abusing medications, that means 4 in 5, or 80% of high school students, are not abusing them. So we encourage you guys to keep being a part of this 80% and making good decisions. We just talked about how prescription drug abuse affects every state in the U.S., and this is a map that breaks down opioid prescribing rates per 100 people. Even though all states are affected, you can see that Wisconsin is actually doing not bad compared to the other states, but we have room to improve. And the 2 darker states here are Alabama and Arkansas, and they're in the darker red color. Opioid prescribing rates began increasing in 2006 and peaked in 2012 at 81.3 prescriptions per 100 people. Opioid prescribing rates began declining from 2012 to 2018, and the prescribing rate is currently at the lowest it's been in 13 years, with the average being 51.4 prescriptions per 100 people. This is a side-by-side graphic comparing U.S. opioid prescribing rates from 2017 to 2018. And as you can see on the right side in 2018, we're seeing a lot more lighter colors, which is indicating less prescribing rates. So we are seeing progress, and this is a good thing because, yes, when opioids are used correctly, they are really helpful to a lot of people. But the idea is that with less prescriptions out there, there's going to be less prescriptions to abuse. So we just want to make sure that the people that have opioid prescriptions are the right people. The prescribing rate in some areas does still remain high. 11% of U.S. counties still have enough opioid prescriptions for every person to have their own opioid prescription. Now, if you think about that, that's pretty crazy because not every single person needs to have an opioid. And so on average, if there's enough prescriptions out there for every person to have one, that's a lot of prescriptions floating around, which could be contributing to people abusing them. So even though we've seen a lot of progress, we still do have some room for improvement. Now we're going to talk a little bit about the why. Why is the potential for prescription drug abuse so high? Here's another question for you guys. Approximately how many retail prescriptions were filled in 2019 in the U.S.? The correct answer is A, 4.38 billion. This comes out to about 12.8 prescriptions per person. Another question. Why do teens abuse prescription drugs? Is it A, to get high, B, to relieve pain, C, to improve grades, D, to fit in, or E, all of the above? The correct answer is E, all of the above. 40% of teens consider the abuse of prescription drugs to be safer than street drugs. Do you guys think this is true? Hopefully not. Both illegal and prescription drugs have powerful effects on the mind and body. And side effects of prescription drugs can actually be really similar to illicit drugs. Some people might be fooled that just because they're getting a medicine from their doctor, that it's safer than something that they could be getting off the streets, but this isn't the case. For example, opioid painkillers like oxycodone, and an illicit opioid like heroin that you can get off the streets actually act on the same part in the brain. Now we're just going to go into a little bit more detail on the specific medication classes that we mentioned earlier. So first up are the opioids. Like we mentioned before, these medications are used to treat moderate to severe pain. They can be prescribed after surgery, an injury, or for certain severe health conditions such as cancer. They do have a serious risk for addiction and abuse, even if taken as prescribed. This is important. One of the reasons that their potential for abuse is so high is that even if people take them exactly how the doctor tells them to, they still carry this risk for abuse. Anyone who takes prescription opioids can become addicted because they're habit-forming and can lead to tolerance and dependence. Abusing prescription opioids can cause a person to stop breathing. This is one reason why opioids should never be combined with alcohol. I'm going to say that one more time. One good take home from this presentation is that if you're ever on a prescription opioid or know someone who is, these medications should never be combined with alcohol. And it's because opioids can actually slow down your respiration rate or how fast you're breathing. And in combination with alcohol, this can become very dangerous. Another drug class that we talked about earlier were the stimulants. These are prescription medications that are usually used to treat things like ADHD and narcolepsy. A common example is Adderall. They increase alertness, attention, and energy, and are sometimes abused by students to try and get better grades. So why is this a bad idea? Well, in short, abusing something like Adderall is illegal. It's a form of cheating, and it's extremely dangerous because it can have really harmful side effects to someone who doesn't have ADHD. For example, they can be at risk for seizures, paranoia, and obviously addiction. Sometimes a student will think that if they stay up all night to study, this will help them get better grades, but that's not the case. It's proven that the brain needs sleep to retain information, and even though a stimulant might keep you up all night, in the long term, this is not going to help you remember anything. This isn't going to help you learn anything, and it can even just force you to focus on the wrong task at hand. Studies have shown that prescription stimulants do not improve intellectual abilities in people without ADHD. ADHD medication is more effective in correcting deficits in people who have ADHD rather than enhancing performance. So I just told you that taking something like Adderall can increase alertness, and you might be thinking, well, how does this not help you get better grades as a student? And this is a figure that I hope will help clear this up a little bit. Someone who is diagnosed with ADHD is kind of sitting down here. The level of chemicals in their brain will sometimes lead them to be distracted or disorganized or even forgetful. When this person takes something like Adderall, they're going to move up to the curve and they're going to end up feeling more focused, organized, and responsible. But someone without ADHD is already sitting right here. And so when the levels of catecholamines or chemicals in their brain increase, instead of just getting more focused and more organized, they actually move downward on this curve and end up again feeling stressed, distracted, disorganized, and forgetful. A third class we mentioned before were the sedatives. Sedatives can be used to induce relaxation and sleep. Side effects include a decreased heart rate, blood pressure, and respiration rate. People who are abusing sedatives may have trouble concentrating, and they could end up partaking in riskier behavior than what they normally would. Sedatives can have a euphoric effect, and this is what can lead them to be addictive. Euphoric means like that feel-good feeling, that the feeling of maybe being high or what someone would describe as being high. And again, because these also decrease the respiration rate, they should never be combined with alcohol. Dextromethorphan is a cough suppressant available over the counter. Effects of abuse can range from inebriation or drunkenness to loss of all senses. Other effects can include vomiting and increased heart rate. Dextromethorphan is often included or combined with other medications like acetaminophen or Tylenol in certain cold and flu type medications like your Dayquil or your NyQuil. And if someone is abusing the dextromethorphan in this, they're also abusing something like the acetaminophen, which can in itself have its own harmful effects, one being liver damage. Rates of addiction can vary from source to source. However, those who have abused this drug report having craved it, and so this tells us that it does have some addiction potential. This next slide talks a little bit about CBD or cannabidiol. And even though this isn't quite related to our presentation, we wanted to include it because it's a hot topic these days, and you're seeing a lot of CBD stores pop up all over Wisconsin. So CBD is found in the cannabis plant, and the cannabis plant includes hemp and marijuana. So when comparing CBD to THC, CBD comes from hemp and THC comes from marijuana. In order to be legal in Wisconsin, CBD must have less than 0.3% of THC in it. And that's because THC is the psychoactive component of marijuana, and that's what would be illegal. Our body has different cannabinoids, and CBD and THC bind to different receptors in our body. Mainly, CBD binds to CB2 receptor, and THC binds to CB1 receptor. And CB1 receptor is responsible for the psychoactive properties or the mind-altering effects of marijuana, whereas CBD isn't thought to bind to CB1, and that's why you don't get the feeling of being high from CBD as you would from marijuana. I do want to bring to your attention that Epidiolex is the only FDA-approved CBD product right now, and so even though you're seeing all these CBD products around, Epidiolex is the only FDA-approved product, and it's actually used for the treatment of refractory epilepsy. Even though you're seeing stores carrying CBD products everywhere, there's a lot unknown about CBD. There's a lot of ongoing studies where we're trying to find out, what exactly are the benefits of this? What exactly is harmful about this? And so it's always a good idea to talk to your pharmacist before taking CBD. It's a good idea for them to look at the other medications you're on to make sure that there's no potential for interactions. So the take home for this slide is the safety and benefits of other products that are not FDA approved are really unknown at this time, and so it's always best just to talk to your pharmacist before taking CBD. Okay, so switching gears back to some statistics, more than 1/3 of teens say they feel some pressure to abuse prescription drugs, and nearly 10% of teens say that using prescription drugs is an important part of fitting in with their friends. Again, like I said before, I want to remind you that even though 10% of teens are saying that they feel they need to do this to fit in with their friends, that means that 90% of teens don't feel that they need to use prescription drugs to fit in. So I would encourage you to keep being a part of the 90% and be a good influence for your peers. You're in the majority by not abusing prescription drugs. Another question for you guys. When justifying prescription drug abuse, what reasons do teens give? Is it A, prescription drugs can't be dangerous, B, prescription drugs can't be addictive, C, it's legal, or D, all of the above? And the correct answer is D, all of the above. Sometimes in situations of abuse, prescription medications can be taken in alternate ways, like crushing or snorting. And even though abusing medications in itself is very dangerous, taking a medication in an alternate way in itself has very serious risks. For example, when you crush opioids, your chances of overdosing are increased. Another example is that there are actually extra ingredients in stimulants that, if crushed, can block small blood vessels in the body, which can be extremely harmful. And so this isn't here we're not talking about if you're crushing a medication to take it with applesauce if you can't swallow pills or anything like that. That's a little bit different. Here we're talking about when people are abusing drugs, they often will take the drug in a way other than what it's intended and that in itself can have some serious risk. Now, that being said, even if you're taking a medication for the right reasons, like I mentioned, sometimes people can't swallow pills and so they'll crush something up and put it in applesauce. You should always ask your doctor or pharmacist before you do that, because some medicines can be crushed and taken in applesauce or pudding, but some medications actually cannot be crushed. That's not how they were formulated, that's not how they were studied, and that's not how they should be taken. And so it's always a good idea just to check with your pharmacist before you do this. So, prescription drug abuse is dangerous, it's addictive, and it's illegal. Remember, we talked about how prescription drug abuse really can happen to anyone. You don't have to abuse or misuse medications to become addicted necessarily. For example, drugs like opioids are habit forming on their own. And don't just think about yourself, think about the people that you care about around you. If you're ever faced with a decision where you feel pressured or you feel, like tempted to abuse a drug for some reason, and if you can't do it for yourself, try to think about someone you love. Think about the people, that are depending on you, that need you, and think about just people other than yourself to try and make those good decisions. All right, and our last section for today is what can you do? So we're going to talk about progress, prevention, and medication disposal. The HOPE agenda is one thing that Wisconsin has been doing to try and help combat the opioid problem. Beginning in 2011, more than 30 new laws have passed focusing on the treatment, prevention, and education surrounding prescription drug misuse and abuse. This includes things like the PDMP. This is a prescription drug monitoring program that pretty much keeps track of and monitors any controlled substances and the filling history of controlled substances for patients. And so this has been a key tool in helping to keep track of what prescriptions are out there and how much of a certain prescription are people getting. Naloxone carrying by law enforcement officers and first responders. We're going to talk more about naloxone in a couple slides. Expanded access to treatment programs. Prescribers and insurers are now more conscious of prescribing habits. And lastly, the standing order. The standing order is something that allows all pharmacists who meet requirements to dispense naloxone to a patient without a specific prescription. So this means that if a pharmacist who has, met the requirements has a patient come into their pharmacy who would be a good candidate for naloxone, they can actually dispense naloxone without having a prescription from the doctor. And naloxone is a medication that can actually reverse opioid overdose. According to this figure from the CDC's website, we are seeing some recent progress when it comes to drug overdose deaths. Overall, our nation saw a 4% decrease in drug overdose deaths between January 2018 and January 2019, while Wisconsin actually saw a 7.2% decrease. This slide talks a little bit about naloxone or Narcan, and this is a drug that is used to reverse opioid overdose. It comes in a couple of different forms. It comes in a nasal spray and an injectable form. The injectable form is either an auto-injector or in a vial where you would, that you would pull up with a syringe. The onset of action is 2 to 5 minutes, and it lasts for about 30 minutes once on board. You get 2 doses per prescription, and so if you were to come across someone who you suspect having an opioid overdose, you would administer the first dose, call 911, and then administer the second dose after 2 to 3 minutes if you're not seeing any sort of response. And again, with the standing order, you can obtain this medication without a prescription from your doctor. You just have to go to your pharmacy and ask your pharmacist about it. So 2 really important points about this slide is that the duration is about 30 minutes. And so even if you were to give this to someone who has potentially overdosed and, it has saved their life more or less, they still have to go to the emergency room. There's a chance that because the opioids in their system will last longer than the effect of the Narcan, they could fall back into an overdose like state. And so it's really important after you administer this to someone or after this is administered to someone, they still need to seek medical attention. The other really important note about naloxone or Narcan is that you can't really hurt someone by giving this to them. So, God forbid if you ever are in the situation where you suspect that someone has overdosed, but you're not exactly sure, you're not sure if you should give them Narcan or naloxone, you should. The answer is that you should, because by giving it to them, you could potentially save their life, but you're also not going to hurt them by giving it to them if they haven't necessarily overdosed. I like to think of Narcan like an EpiPen, for example. People who are allergic to bees, they carry around an EpiPen just in case they get stung by a bee. They don't want to be stung by a bee. They're not going to get stung by a bee on purpose, but it's still good to have the EpiPen just in case. And that's kind of a good way to think of naloxone. Even if you don't anticipate ever being around someone who is overdosed on an opioid, it's a really good thing to have as a just in case measure. So what are some things you can do to prevent prescription drug abuse? Some obvious ones might be don't abuse drugs yourself. You can encourage your friends not to abuse drugs. You can support friends or family who are struggling with prescription drug addiction. And another important one that we sometimes don't think of is removing old or expired medications from our homes. Old, expired, or unused medications at home are actually a huge risk for abuse, so removing them from your house is actually really important. It's also important to dispose of medications responsibly. We do not want to flush our medications because they'll just get into our water supply. So the best way to get rid of your old medications is to actually just call your local pharmacy and they'll help you find a place that will take back your old medications in a safe way. There are services called MedDrop. The School of Pharmacy actually has a different organization, a MedDrop organization that hosts different drug take-back events where people can come and bring any old or unused or expired medications. There are certain mail-back programs where you just mail your old medications back in. And a lot of places actually have permanent receptacles where you kind of just dump your old medication in. These look similar to like one of those blue mailboxes. It just has a handle and you open the handle and you dump your old medications in, no questions asked, and that's about it. A lot of times pharmacies will have these receptacles. Even more common, police stations will have these receptacles. Now, a lot of people are always really hesitant to go to a police station to get rid of some of their old and unused medications. But honestly, it's really discreet. They're not going to be asking you any questions if you're actually bringing medications back to dispose of. They're happy that you're being responsible and disposing of them in a safe way. So disposing of medications is a great way to prevent abuse. 70% of those reporting abuse actually get drugs from homes of families or friends, and disposing medications can help prevent poisonings, ensure medications are used effective, and it will help protect the environment if you dispose of them in the proper way. So in summary, prescription drugs are not safe alternatives to illicit drugs. Addiction can occur just as easily with prescription drugs as it does with illicit drugs. Possessing a prescription drug without a prescription is illegal and a felony offense. And it's always important to responsibly remove old and expired medications from your house. All right, well, that concludes the rest of the presentation today. Thank you guys for taking the time to listen to this today. We really appreciate it. If any questions come up, feel free to reach out to your teachers. They'll know how to get a hold of us. But other than that, have a great rest of your day.